Aetna announcing yesterday that it will completely withdraw from the marketplace in 2018. This as Republicans are facing angry constituents at rowdy town hall meetings this week. New Jersey Congressman Tom MacArthur, for example, was forced to defend the GOP Obamacare replacement plan just last night.
I have a wife that had breast cancer. She will always have a pre-existing condition. I don't want to have to choose what state I live in order to get health care for her.
I don't want you to have to move to another state either to get health care. I want everyone, every American, to be able to afford and get and have continuous health care insurance.
Joining us right now is the former chief of staff under President Obama and Commerce Secretary under President Bill Clinton. Bill Daly is with us. Bill, what do you make of these developments?
It's not surprising. Obviously, when you talk about health care, the American people will get very energized for two reasons. One, it's such a large part of our economy, and it's all very personal. The Republicans, or Democrats, pardon me, in 2009 and 2010 felt the wrath of people at town hall meetings when the health care bill was being argued and debated in Congress. So now it's flipped the other way. The Republicans they voted 67 times or whatever it was to repeal without any replacement. And now they're forced, in a rather short period, to come up with a replacement in a very, as President Trump realized last month, a very complicated thing called health care. So it's not surprising that you've got a lot of anger, a lot of concern, a lot of angst over how to go forward. And even if you look at, Maria, the House action, they tried one bill and it failed. They went back and got the Freedom Caucus to agree to something. Nobody really read it and rushed it through, tossed it to the Senate, and now the Senate, according to most reports, is going to start all over. So we still have a long way to go, and it doesn't surprise me that Aetna said they will pull out in 2018. I think a lot of the insurance companies are trying, and not wrongly so, help build pressure to get some of these things solved so we can have a system that can work, give the sort of coverage everybody wants for people, and try to make it as affordable as possible.
But don't you think, I mean, everybody wants a health care system that works. It's important. It's vital for our economy. It's vital for our people. And yet we see that Republicans and Democrats are unwilling to come together and have a conversation. We see every piece of evidence that's suggesting that the health care system that's in place right now is not working. I mean, with Aetna coming out now, Humana already coming out, what alternative do we have but to come together and address this?
So why wouldn't, and I get the new rules in Congress, and it's not either side, it's both sides. You have to get your caucus and get all the votes to pass a change just in your caucus. Democrats did it for Obamacare, and long term it proved a mistake, even though the Republicans wouldn't cooperate. You cannot make such basic changes to the American people's way of life unless it is done in a bipartisan way. In my opinion, the Senate right now, because it's in their lap, and the President should sit down in a serious way with Democrats and say, how do we change this? You're not going to make the Freedom Caucus happy, and you're not going to make the far left of the Democratic Party happy, who may want a single-payer system. But unless there's a system that makes some bipartisan effort that no one may be happy with at the end, as far as the politicians are concerned, you're going to continue this battle, and people are going to suffer because of it.
I agree, but that's not the way it was done in the first place, right?
I said that. I said that. Now, from the Democratic side, the Republicans said, we won't play. We like the system as it is, basically. Right. We don't want to play. And the Democrats, who controlled the system at the time, went ahead and passed the Democrat-only plan. For 8 years, the Republicans voted to repeal. Never once put a replacement plan on the table. President Obama, even when I was there, said, give us your ideas. How do we change this? We know we've got to change this thing. Never once until this spring did the Republicans put a full package together on real replacement, not just repeal.
Well, they had the 8 years, Jake, and you've said it for a long time. They had the 8 years. They should have been ready for it with a repeal and replace.
Right. Right. Everybody should have been ready for it.
Bill, I agree with you on that, but the Republicans are now playing ball on a field built by the Democrats. And what I mean is that with Obamacare, that it was presented as it's the government's job to make sure that everybody in this country has health insurance, that it's the government that needs to guarantee that that happens. And so the Republicans now have to work from that.
Well, look at you have a system that the government is responsible, but most Democrats, many Democrats I would say the government should run the whole system, and as they do in most parts of the democratic world, and not have this hybrid. President Obama tried to put in basically Mitt Romney's plan for Massachusetts, which had private sector involvement, the insurance companies. It was an attempt to merge the two, the old system, which wasn't functioning, which we all know, and that full government-run system, which most people didn't want. So it was a hybrid. That hybrid has turned out to be very difficult to support for some of the reasons you've talked about and to survive. But that's why I say you have to get real, not just the politicians together. How about the healthcare industry together to say, how are we going to make this work? And it takes real leadership from the president. It's complicated. You've got to get into the details. And you can't start with, well, we have to first get 217 House Republicans to vote for something, and then we'll go say to the Democrats, okay, what do you guys want?
Bill,
you've been
chief of staff. You've been right there as chief of staff. So what advice? I get the notion of your enthusiasm for a bipartisan effort. So I'll concede that point. But how do we get there from here? We basically have a bill that was rejected. Now it's being repolished. How do you take it to that next step in the Senate context? What would you have the president do? Because, frankly, it sounds wonderful, but I need your GPS. I don't see any way to get there.
Well, it will take basically the president stopping. First of all, stop trashing the Democrats who may have to be involved in this system to get it changed, and sit down with them. I don't know if you remember when President Obama did like an 8-hour televised town hall discussion with members of Congress. John McCain was there shortly after the president had beat him to have a discussion about health care. Have something that is bipartisan. Have Ted Cruz, have Bernie Sanders, have a whole bunch of people, bring in the industries, and sit down and say, okay, we're living in this Obamacare world. It's not working as we all had hoped, many of us hoped it would work, needs improvement. What, or are you just going to cater to basically try to blow it up and save one or two parts? Namely pre-existing conditions, and kids who are 26 or under can stay on their families. So I think it's at that point. If they jam through something in the Senate, which I think will be very hard, try to patch together a Republican-only bill, we'll be 2 or 3 years from now with the next president dealing with the same thing. And I think this is too important to our economy and too important to our system.